This is RadPod, a podcast produced by ASMERT, the Australian Society of Medical Imaging and Radiation Therapy. ASMERT acknowledges the Bunurong people as the traditional owners of the land from which we record this podcast and pays respect to elders past and present. There's over 20,000 cases of breast cancer diagnosed every year in Australia and also around 3,000 deaths per year. And most of our listeners would be familiar with the various imaging options relating to breast cancer. Not all breasts are the same, so imaging them is not going to give us the same information for each patient. So for example, breasts with a higher density can mean a less optimal mammogram. To talk more about all this, I'm joined today by Todd van Auken, who's come all the way to Australia from the United States. So Todd's the Assistant Dean in the College of Health Sciences at St. Petersburg College in Florida. Welcome to RadPod and welcome to Australia, Todd.
Thank you.
Todd's got a lot of experience in both diagnostic and interventional radiology. And so you're probably thinking, well, why the hell is Steve talking to this guy all the way from the United States about dense breast and mammography then? Well, Todd's here in Australia at the 2026 ASMERT conference in Hobart to talk about this based on his own personal story. Now, I'm going to get to that in a moment, but first I want to talk about the International Speaker Exchange. So Todd's the first recipient of the International Speaker Exchange that ASMERT has with its counterpart, the ASRT in the United States. This was an initiative set up between the two organisations in 2025, where the ASRT sends a speaker to each ASMERT conference, and in return, ASMERT alternates years sending a radiographer to RSNA in Chicago one year, and then a radiation therapist to the ASRT Radiation Therapy Conference the next year. So Todd, how does it feel being the first recipient of this from the US side?
Honestly, it's both humbling and exciting, and it really shows where our profession's heading. More collaboration, more shared learning, and a broader global perspective.
Wonderful. So let's talk about what you've come all the way over to Hobart to present on, and that's about imaging of dense breasts based on your own personal experience. Can you tell us about the personal experience that you've had?
Absolutely, Steve. In 2024, my wife, at the age of 44, had her third annual mammogram screening.
Mm-hmm.
There wasn't mention of density. She had heterogeneously dense breast tissue, which may obscure small masses. But overall, the diagnosis was BI-RADS category 1, which means negative.
Yep, right.
And this was the same report on her prior two mammograms before this one.
Mm-hmm.
About 5-6 months later, during a self-exam, she found palpable masses in both breasts.
Mm-hmm.
And with further medical imaging and biopsies, it was determined that she had a bilateral invasive ductal carcinoma that had spread to her bone.
Oh, God, that sounds like a very tough pill to swallow, I think, really, particularly if you've been diagnosed with stage 4 cancer after all of those supposed negative tests that you've actually had. How's your wife doing now?
Well, there's been a lot of ups and downs, but fortunately, after a year of treatment, she's been responding really well. The tumors in her breasts and her bones have all shrunk.
Yeah, great.
So we're just hopeful that she holds it off. And then in a few years, hopefully there's a new treatment or even a cure.
And do you think that knowing that she had dense breasts, if she went on to have other imaging, that they would have probably picked this up earlier?
I do believe so.
So out of these negative tests, where the report mentioned the dense breasts, what further imaging is available to these patients in the United States?
Well, if it's ordered or recommended, it has to be recommended by the radiologist or ordering physician.
Yep.
There are contrast-enhanced mammography, ultrasonography, and breast MRIs, and all three of them have a greater detection sensitivity than conventional mammography.
Is there one in particular that might be better than the other?
Breast MRI has the highest sensitivity.
Yeah, but obviously there's issues as far as access to MRI is concerned and things like that, particularly in Australia. There's a big issue with access. Do you think that contrast-enhanced mammography would have had that sensitivity enough to be able to detect it in your wife's case?
I'm not sure, but again, it is more sensitive than conventional mammograms. So there's a possibility for sure.
Yeah. Okay. Now, the radiographer or the radiological technologist, as you call them in the US, who is conducting the mammogram, they should be able to recognize the dense breasts. What role do you think that they currently play, and what role should they play in discussing this with the patient?
Well, I think we have to look at our professional practice standards and code of ethics. And first and foremost, both countries, we do not diagnose and we do not interpret. But what is encouraged is communication.
Yep.
And, with that, I truly believe the radiographer should feel empowered to speak.
Yeah.
And in my opinion, advocacy starts in the exam room.
Yeah, absolutely. And look, I really like this concept because it does really sit within the current MRPBA professional capabilities, which is what underpins our profession in Australia. And we're kind of talking about the advocating for the patient, as you suggested as well. And that's what really, I guess, is part of those professional capabilities themselves. So what can the mammographer do to advocate for the patient in the room?
Well, first, I think they should be able to explain what dense tissue means to the patient in simple terms. Second, they should be able to encourage follow up with their provider.
Yeah, okay.
And then lastly, maybe hand out a pamphlet or some type of literature information that describes what the limitations and the implications breast tissue density to the patient.
Yeah. Look, I think there's some really, really good ideas here about giving that empowerment back to the mammographer themselves and allowing the patient to understand more about the limitations of the mammography. What about beyond the room conversation itself? Like how do we see as a profession that we can advocate for patients with dense breasts that's outside of the mammography room?
Well, I have a lot of colleagues and former students who found a passion in mammography and breast health.
Mm-hmm.
And they, first and foremost, they participate in quality assurance and process change within their departments.
Yeah.
This may be a notification, better ways to notify the patients, what exactly they can say and what they cannot say, just simple things like that. Beyond that, a lot of them are speaking at conferences such as this one.
Yeah.
They're participating in awareness events.
Mm-hmm.
And then some may even link up with larger organizations to advance or advocate policy change on a national level.
Yeah, right. And that's kind of something that you're looking at, I guess, at the moment.
Yeah. So right now it's starting small, but my hope is to get the message out.
So what is that current legislation in the United States?
Well, right now, before 2024, it was a state mandated. It depended on the state. If the state had a notification law in place, then the woman would get notified that they had dense tissue.
Yep.
But in 2024, the Food and Drug Administration made it a mandate that all states must inform women of their density as well as encourage provider discussion.
Yeah.
And we currently have a BIRAD system, A, B, C, and D, depending on the density type. A would be fatty and so on. D would be extremely dense.
Yeah. Yeah, we have that in Australia as well. And the majority of the population in Australia are at a B level. Now, Breast Screen Australia has a guidance document for general practitioners about dense breasts, which states that the sensitivity for a mammogram is 90% for women in category A and B, 84% for C, and only 64% for D. And on top of this, women in category C and D have a slightly increased risk of developing the breast cancer itself. And then this risk then needs to be considered in the context of their overall risk of breast cancer, such as the age and the family history and so on. And the guidance then goes on to talk about the next steps when they are in one of these higher categories and in different contexts. So this might kind of be further imaging, such as contrast enhanced mammography or MRI, as you have suggested before. But ultimately, this is guidance for GPs rather than the women themselves. And breast screen services in some states do provide information to the patient about their breast density in the mammogram result letter and are advised to contact their GPs to discuss any concerns. But Breast Screen Australia also released a position statement on this in 2024, recommending that women are informed in writing of their breast density as measured on the mammogram. Now, that's at a radiologist level, as you kind of suggested before, not necessarily at a mammographer level in that. And so this then comes back to that empowerment of that as well. And I'd probably also like to point out that even though MRI is one of the further imaging tests, it's not necessarily funded by the government. So if a woman with dense breasts has to go to have an MRI because of the breast density, they would have to then pay for it themselves, which can obviously be quite costly, and that's going to reduce the number of people actually trying to do it, unless they fall in a very, very small category of patients where it might end up being funded. So, Todd, is there a difference between Australia then and the United States about this? And what does your advocacy look like in the US for creating that change?
Well, I think it's similar for sure. But, since 2024, now we have a national system of notification.
Yeah.
So where every state must notify.
Yeah.
But despite that, there's still gaps in understanding.
Mm-hmm.
And this is, in my opinion, where the role of the radiographer is crucial.
Yeah.
They're uniquely positioned to bridge the gap between the image acquisition and patient understanding of just what that density means.
Excellent. Look, Todd, thank you so much for taking the time to speak with us here in Hobart for RadPod. And again, congratulations on being the International Speaker Exchange recipient for the first time, coming all the way to Australia. Just to finish up, what advice do you have for all the mammographers out there when it comes to imaging women with dense breasts?
Simple. It's don't be afraid to speak up.
Great. That was very simple. Thanks again for your time, Todd. I really hope that you enjoy your time in Australia. Best wishes to your wife on her recovery as well. And one final note on the International Speaker Exchange for all the Australian listeners out there. Applications open up for this around September each year. So keep your eye out on the promotion of this through the ASMERT socials. Todd, thanks again for joining us.
Thank you, Steve.
Thanks for listening to RadPod, a podcast produced by the Australian Society of Medical Imaging and Radiation Therapy.